Okay. So firstly, tonight, I would like to introduce Rural Onboarding 2023 and give you all a very, very warm welcome. This program is now in its third year. It started off as a pilot in the Eastern Cape 2 years ago. And now last year we went national, and this year we've gone a little bit global with even participants coming in from the rest of Southern Africa. And what I want to do is just have a quick 10 minutes to a little bit I guess explain the reasoning behind rural onboarding and why it is here and what it's all about. And it basically has a little bit to do with helping young doctors thrive in rural health. And we even hope that some of them might decide to stay after your community service officer years. So there's lots of ways of looking at thriving in rural health and how we help doctors thrive in rural health. But I'm going to use one particular little model that's a little Venn diagram from Dave Issei that I've always found very useful. And one of the things we see with doctors who are really resilient in rural health and love being in rural health is that they feel that their work as a medical professional is a calling, not just some job you found out with, you show up for. And how does something become a calling and not just that job that you have to do? And Dave Issei, he finds that there's three factors that need to overlap. You need to be doing something that's making people's lives better. You need to feel appreciated for what you are doing, and you need to be doing something that you're good at. And I'm going to very briefly look at those three things and where rural onboarding fits into all of that. So the easy bit of the Venn diagram is making people's lives better, because we have these extraordinary rural health superheroes, which is the community service clinician. And the foundation of rural healthcare in South Africa is our community service officers. So also a big shout out to all those medical officers that have joined us. But for those of you that are now in a community service year, even though that year can feel like a sort of a big chunk, in your whole career, that's going to be 1 year out of your 40 years. And all of these years added over decades from community service officers is what's keeping rural health going in South Africa. And the reason why we're actually able to provide extraordinary access to care, even in our most rural districts, is because we have young, newly trained doctors, clinicians, rehab, nurses, clinical associates that come out and see patients there. And you will, within your community service here, be making a difference to hundreds of people's lives who would not otherwise have access to care. So that's an easy tick. The second one is about feeling appreciated. And this is something that RuDASA is specifically taking on in 2023. So one of the big events that I'm punting here very quickly is our Rural Health Conference. It's a combination conference with PACASA, that's the clinical associates, RuDASA, the rural doctors, the rural nurses, and the rural rehab guys. And our conference this year is going to be in the Eastern Cape from the 14th to the 16th of September. Right in my backyard, so which means I'm organizing it. And it will be in Tinsa this year. And our theme for this year is celebrating rural health. And we specifically want to celebrate the service that community service doctors, junior doctors, medical officers, all of those people that are supporting rural health care, all of those extraordinary clinicians that provide amazing care every day. And we want to celebrate that specifically this year and make us feel a little bit more appreciated for that amazing work. But of course, rural onboarding is going to go in specifically about talking around, to be able to feel that something's your calling, you have to feel that you're doing something that you're really good at. And if you are confused about why I have cricket players up there, I always like to give the example of, in cricket, you have something called a batting average. So that is the amount of times that you manage to hit the ball that they throw towards you. And an interesting question is that as a doctor, imagine you had a batting average, and let's make it a percentage of the amount of times that you get the right diagnosis or figure out the right treatment to give a patient. And the question I want to ask is, what do you think your patient expects your batting score to be? If they're going to go choose a doctor, anybody would like to put something in the chat there? What percentage do you think your patients expect your batting score to be in terms of diagnosis or in terms of getting the right treatment? Anybody would like to put something in the chat? Thank you for everybody adding all their email addresses. Everybody's looking for the chat button. So this is a question there we go. get some answers coming through. Whenever I ask this question and all the different courses I've done over the years, people always go, well, probably by over 90% at least. Certainly, if you go off and take your mother to see a clinician, you would certainly hope that that's going to be a very high batting score. And as doctors, we have internalized that. So as clinicians, we should be able to always come up with the right diagnosis or the right plan or the right treatment. And this is probably one of the reasons why there is such high burnout in clinicians, is because we've actually set the bar very high. And the reality, of course, is that no individual clinician will ever know everything. So if you feel at the beginning of your community service here, oh my goodness, I think there's so much I don't know, and I don't even know what I don't know, that will never change. So even those of us that are consultants who's been working for more than 20, 30 years in medicine, every single year things are changing. There are always areas I need to update myself or remind myself, and you will never get to a point where every single patient you see, you know exactly what the right answer is. But the collective wisdom as healthcare providers is extraordinary. We know a lot. And within our collected guidelines, mentors, experts, clinicians, the answer for every patient, actually mostly, even if we don't have an answer, we certainly can make a plan in terms of figuring out what we need to do or what's going to be the best way forward for our patient, or at least give them a clear understanding of where they can take something forward. And so what makes a great doctor is not, or a great clinician, is not what you know, but your willingness to ask, your willingness to be able to say, okay, I'm not so sure now, and being able to get the next answer. And that's not necessarily just people, but also being able to access resources. So a couple of tips in terms of that, as you are not only a young doctor, but for those of you that are already also being in rural health for a while, is make sure you have good offline access to a whole host of credible resources. And one of the first things that Rural Onboarding will do is provide you with lists of references, materials, the right SDG, the right latest EMLs, the latest NDOH guidelines, the Zelela handbook, the latest adult primary care book, and make sure you download those in some sort of PDF folder so that you're actually able to access them when you don't have Wi-Fi. And this is when you have a patient, you have to be willing to look up, check something, double check something, make a little note and look it up in the evening. And in that way, every single patient you see is actually already a learning opportunity. The other thing you want to do is identify people you can contact, or mentors, experts that you can get hold of. So if you end up in a hospital where you're literally the most senior person in that hospital in your field, try and figure out who can I get hold of on the phone, who in the referral hospital is accessible, speak to your colleagues. We will send out national hotlines. Their medicine information center is extremely helpful for any HIV and TB and any pharmaceutical related questions, for examples. There's some amazing WhatsApp groups on which you can post questions. And it's good to know this before you go on call and it's 11 o'clock at night and you're not sure where to get hold of information. So you need to be able to have ready your list of different mentors or people you can contact. And then lastly, and this is something we all have to do as medical doctors, is you actually have to build some reading time into your week to keep on track. And again, we're going to be providing you with so much resources that it will take you a lifetime to cover all the stuff we're going to send you. So you want to make a little bit of time every week to read up on stuff that you might not see every day. We were chatting the other day here in the Eastern Cape. We don't see much malaria, for example. So I'm completely out of date with malaria. And then we've had a couple of cases of travelers that presented with malaria at a district hospital. So there's some things where you sort of just want to keep an eye on what guidelines are out there. Is there anything new in a specific area, et cetera, et cetera. And we're hoping the resource packs will help you structure that reading time. Some of you might be aware of what they call the 5 a.m. club. And certainly in my life, I have found it useful to build an hour in the mornings to be able to get some learning done and get some reading done before all the kids wake up and the world starts. I'm just going to mute this. There we go. Okay. And then in terms of the rural onboarding itself, our purpose is therefore not to be able to be, this is not a didactic training program where we're going to spoon feed you a whole lot of information. this is a bit like a roadmap. And you can see here, if you look at the 8 different sections we're going to cover over the 8 weeks, this literally covers the whole broad spectrum of the different fields that you work in when you're within a rural health facility. I know it's very clinically orientated. We're hoping to create some parallel rehab programs as the years go past. But all of these areas you're going to come across every single day in your practice. So just in a busy OPD, you can literally see patients under almost any of these 8 sections. And so we're hoping more to help to structure your learning and your development over the next 8 weeks. We are busy finalizing the webinars, and we'll send you the final date when everybody is confirmed. This is just to give you an idea. We have an excellent list of webinars that's happened over the last 2 years, which we'll be sending out tomorrow. You'll be getting your first resource packs. And so although there's only 1 webinar a week, for example, we're only going to talk about TB this week out of the whole spectrum of infectious diseases. We have some excellent videos, for example, on HIV, etc., that you can look at. And then what I'm very excited about, and a huge thanks to Steph and the WITS JCP students. We've got an amazing group of WITS students, IT students, that's helped us build an actual online portal. So all of you should have been able to get access to our learning portal when you signed up for the Rural Onboarding. For those of you or anybody who signs up to RuDASA can get access to this portal. It's all free. RuDASA membership is free. And you can see the packs that I'm going to send up is all actually reflected on the website. So if you're somebody who rather just wants to have the portal on your phone and being able to access the different sections with different resources. And so to be able to thrive in rural healthcare, you need to remember you are doing extraordinary work for which we are very grateful, and we do see the amazing work that our rural health clinicians are doing in those little distant rural areas. And never fear your lack of knowledge. You are part of an awesome community. And if you are willing to ask and check and find out from your team on how to help every single patient that you see in front of you, you'll be able to be a brilliant doctor from the first day as a community service officer clinician. Doctor or rehab or nurses, apologize for my terrible partialness. So there are my email addresses for those of you that have any questions. And we look forward to having you as part of Rural Onboarding, and you'll be getting your first packs from me from tomorrow. I'm now quickly going to introduce our speaker for this evening.